Hello everyone. Welcome to Group C's MedU Aquifer presentation. We were assigned a case of a 57-year-old woman named Maria Sanchez who came to the clinic with complaints of increasing fatigue in the last 3 to 4 weeks, increasing blurred vision over 2 months, increased urinary frequency over 2 to 3 weeks, and burning sensation in both feet for the last 4 months. During the intake process, our group was able to obtain more information regarding her health history. In order to address Mrs. Sanchez's healthcare needs, our group developed certain approaches to care. Here are Group C's members describing various approaches and care modalities that will assist Mrs. Sanchez in reaching her healthcare goals.
Diabetes is a chronic disease resulting in multi-organ damage. The American Diabetes Association recommends screening for all patients with a BMI of 25 meters per kilo squared or a BMI of 23 for Asian Americans. Risk factors that we should look at are summarized in the next few slides and are therefore vital in the early detection and diagnosis of diabetes type 2. For obese patients without any of these risk factors mentioned, screening should begin at the age of 45, and if tests are normal, tests should be repeated at least every 3 years, or more frequently depending on risk status and initial results. Online calculators that compute BMI are available. However, to review, BMI can be computed by the weight of the patient in kilos divided by the height of the patient in meters, then the answer divided by the height in kilos.
Hello everyone, my name is Anna. I'm doing the slide on nutrition counseling. The importance of adhering to a diabetic diet is assuring that the patient knows that carbohydrates can have a direct effect on the blood sugar and that the dietary fat can affect the health of the heart. Instead of teaching complex concepts like carbohydrate counting and the exchange system, I would introduce the patient to My Plato, which is the Spanish version of My Plate, to teach patients that Half their food intake should include fruits and vegetables. And eating a consistent amount of food every day and taking medications directed can greatly improve blood sugar and decrease the risk of diabetes that's related to complications such as CAD, kidney disease, and nerve damage. In addition, these measures can impact weight control. I would also include the websites to provide the patient that is Spanish fluent about basics diabetic care and the food pyramid, and also the Choose My Plate. Thank you.
Nurses as educators play a key role in improving the health of the nation. The goal of health education is to help a patient meet their health goals of learning how to live with the disease process and maintain quality of life. This requires good communication and understanding of the patient. Health education must be individualized and focus on goals that are consistent with the patient's personal lifestyles, values, and beliefs. First, we will assess the 57-year-old female diabetic patient, focusing on her characteristics, beliefs, motivations, readiness to learn, health risks and problems, current knowledge and skills, and barriers and facilitators to learning. Second, we will develop learning outcomes. We'll identify our patient's goals and identify what she needs to know, do, and believe in order to progress through the behavior change process. Third, we'll create a teaching plan that will include what information, skills, and attitudes needs to be taught and the level of learning to be achieved. This step will also take into consideration the patient's preferred method of learning, such as visual, demonstration, simulation, or audio. Fourth, we will evaluate the process by measuring achievements. This is done by observing demonstrations, test results, and patient self-monitoring and reporting. This step will tell us if our patient is benefiting from our educational plan or if modifications are needed. Finally, we can assist our client by providing resources for her to continue her education, such as counseling, peer support, and health services. Living with a health condition like diabetes type 2 can be difficult, but can be managed with multiple treatment options. One of these options is a healthy diet. The term diet may sound scary, however, it should be viewed as a lifestyle change and a focus on maintaining a balance in comparison to restrictions. Using a popular app on your mobile device can help you live a healthy lifestyle and naturally manage your diabetes. Go Meals application is free and easy to use, and it can be downloaded and accessed at home, at work, or wherever you go. The app provides tools for eating healthy, staying active, and tracking your glucose levels. So the ability to manage your disease and stabilize your future is in the palm of your hands.
The role of exercise in the diabetic patient. Diabetic patients require various medical and therapeutic interventions to control their blood sugar levels. After assessing a patient's condition, the healthcare provider will give medications as well as a list of diet requirements for the patient to live a healthy lifestyle. Besides having a proper diet, physical exercise is one of the most important interventions that are proposed to diabetic type 2 patients due to the role it plays in reducing the effects of diabetes on the patient. For patients with type 2 diabetes, physical exercise is an important element in the treatment. Physical exercise is a proven way through which diabetic type 2 patients can effectively control their blood sugar level without medical interventions. Diabetes type 2 is normally brought on by excess glucose in the blood, and therefore regular exercise assists in using this glucose, thus reducing it significantly. Healthcare professionals should recommend or prescribe physical activity and exercise to all diabetics in order to manage glycemic control and overall health. Recommendations and precautions will vary by type of diabetes, age of the patient, activity or exercise done, presence of diabetic-related health complications. We should tailor our recommendations to fit the individual. Exercise can be considered anything from walking and dancing to weightlifting or yoga. The most important aspect of exercise is that it is something the patient will do and enjoy in order to maintain their regime. The overall goal should be to decrease sedentary time. We have all been told that sitting is the new smoking. This is even more so for our diabetic patients. Our case study patient is a 57-year-old Puerto Rican female with a history of diabetes type 2 and hypertension. She complains of fatigue, increased urinary frequency, feet burning, and blurred vision. She lives with her sister and is active in her church. Our recommendations would be that she join or start a working group within the church 3 times weekly and increase as tolerated. She needs to pay special attention to footwear and inspect her feet after each session. We will also prescribe gabapentin 600 milligrams by mouth 3 times daily. We will increase her glycemic control with medication and diet. We will have her follow up with an ophthalmologist. Because of this patient's role in her church, she may be more inclined to be active within her church. All diabetics are at risk for ulcerations to the feet, so special attention should be paid in this regard. Gabapentin will help with the burning of the feet, as foot pain may keep the patient from exercising on a regular basis. Better glycemic control will help with fatigue and urinary frequency and prevent more eyesight complications. Her poor eyesight can be a safety issue during exercise, therefore a follow-up with ophthalmology is important.
Stress management with type 2 diabetes. Stress requires an emotional behavioral change in the mind and body when it senses threat. Body functions increase and decrease and become ready for flight or fight. This yo-yo effect in the body is harmful wear and tear on all of your body systems. The flight and fight response does not always work so well in people with type 2 diabetes. Insulin is not always available to unlock the cells, therefore glucose begins to back up in the blood. As the stress hormones, adrenaline, cortisol, and epinephrine, rapidly kick in and increase, blood sugar levels soar to harmful heights. This has a negative impact on all body systems. The American Diabetes Association says a major barrier to effective glucose control is stress. As we look at the stress coping strategies for Maria Sanchez, we want to identify the top challenges to help make changes for better glucose outcomes. Some calming strategies include deep breathing, music therapy, silent meditation. Exercise increases endorphins, the happy chemicals in the brain that increases your well-being and happy moods, which decreases stress. Behavioral modifications may include attending more social functions and social interactions with others as an outlet for loneliness. Continue to get restful sleep. And education relating to insulin to alleviate the anxiety she is experiencing due to being uninformed.
Complementary and alternative strategies. Our case study of a 57-year-old Hispanic patient include the use of hot and cold properties and curandero. Other complementary alternative beliefs for diabetes include the use of herbal supplements such as chromium and ginseng, acupuncture, biofeedback, plant foods such as cinnamon, brewer's yeast, buckwheat, broccoli, and other green vegetables, coffee, and sage. The use of bitter gourd is also popular amongst patients with diabetes. Bitter gourd, also known as bitter melon, can be helpful for controlling diabetes due to its blood glucose lowering effects. It tends to influence the glucose metabolism all over your body rather than a particular organ or tissue. For APNs, it is important to collect detailed history of herbal supplements, educate patients on the use of herbal supplements, and research the effects and side effects of potential use of herbal supplements. Community resources that are also helpful include diabetes support groups and CAN providers. There are many biofeedback apps that are also useful for patients suffering from diabetes, including the Glucose Buddy, Diabetes Connect, One Drop, and BG Monitor Diabetes. All of these different apps are able to track and log blood glucose levels, carb intake, and weight, and are intended for people with type 1 and type 2 diabetes.
Now that we have discussed several helpful strategies that will help promote Mrs. Sanchez's overall health, it is our hope that Mrs. Sanchez will adhere to the plan of care. It is also our goal to follow up with Mrs. Sanchez on a regular basis as we continue to identify areas that require more educational support or further intervention. Thank you for listening to our presentation.